I'm Faith, and I have a doctorate in physical therapy. And in this video, we are going to learn what the rotator cuff is, what are some common symptoms of a rotator cuff injury, and 3 types of exercises to start doing today to help your shoulder pain and to overcome your rotator cuff injury. All right, so what is the rotator cuff? The rotator cuff consists of 4 muscles: your supraspinatus, your infraspinatus, your subscapularis, and your teres minor. And these muscles work to kind of fine tune the movement of your shoulder within that ball and socket joint. And they work to elevate your arm out to the side and also to rotate your arm, which is why it's called the rotator cuff. So, what are some common symptoms that might indicate that you have a rotator cuff injury? One of the big hallmark ones that I hear people say all the time is that they have pain sleeping on that shoulder and they can't sleep on that shoulder. Another one is going to be pain with movement, limited movement or a limited range of motion, so not being able to reach as far as you could, as far overhead, behind your back, out to the side or across the car passenger seat, and also weakness in that shoulder compared to your other side. Okay. All right, so there's going to be 3 types of exercises that you can focus on for a comprehensive shoulder rehab program from a rotator cuff injury. So the first one is going to be rotational movements. And these can be with bands or dumbbells or cable machines. So I'm going to show you with a band. So rotational movement, external rotation here at your side. And then you can also come up at like a more of a throwing position overhead. So that is one example of a rotational exercise. The second type of exercise is going to be closed chain exercises, or what we call like weight bearing exercises. And a good example of that is just a standard simple plank. Trying to get some weight through the shoulders to work on stability of that joint. And then a more advanced version of that is going to be a plank, dumbbell, or kettlebell drag. So we're working on single arm stability here. And then lastly, the exercises that you're probably most common with are going to be your complex weightlifting movements. So your big push-pull movements. An example is just going to be a dumbbell overhead press or a dumbbell row. You can also throw in bench presses, pull-ups, any kind of your typical weightlifting movements for your shoulder. A good shoulder weightlifting program or rehab program is going to incorporate all 3 of those. So if this video hit home and you have some of these common rotator cuff symptoms and you would like some additional help with a rehab program, there's going to be a link below. You can book a free 15-minute phone call with me, and we'll dive a little bit deeper into your specific pain, your goals, and see how we can help you there.